Hype around bee propolis for oral care benefits is at least 10 years old, but to date, there hasn't been really any wide commercial success to date. You can find some products on Amazon, but they are definitely in the minority and they're not among the high sellers. Will recently published data, however, clinical data, possibly reignite interest in this space? Hello again, I'm Dr. Rob, accompanied by Tami, my co host, and you're listening to Dental Formulator's Playbook.
So, welcome. In the last episode, we talked about hops and prenylflavonoids, and Propolis also has prenylflavonoids, right?
Yeah, that's right. Propolis certainly does. And we discussed that in the hops cones, that's where the resins are, right? And, that's where they hold all of those important flavonoids. Well, also with propolis, the resins are there and they also hold the prenylated flavonoids.
Okay, so we discussed the composition of hops cones in the prior episode,
Yep.
and I was surprised to learn it has protein.
Yeah.
Again, it's not a food group, people. But what about the
Oh, there's
composition of
gonna be people that
propolis?
disagree with that. Yeah, there's who disagree with that, and I can understand that. Yeah, man, it's
Okay,
it's caloric rich. It's a meal substitute.
absolutely true.
You know.
So, are there proteins in propolis?
Yes, there are. Actually, there are none. Lie. So there are no proteins in propolis.
Wow.
There are in hops, but the only thing they really share in common with each other are those flavonoids. Okay. They
Okay.
have different flavonoids. They also then, of course, have resins. And so again, just like how resins were at least the bulk of the hops, also the same thing with the propolis as well.
Okay.
Okay. So, if there is any protein in the propolis, you're talking much less than 1%. I haven't seen a lot of research that actually talks about that. So let's, for all intents and purposes, say there's no,
Okay.
there's no protein in the propolis. Now, there is about 30% or so lipids and waxes. Probably not surprising. These are bees. They produce honey, and usually that honey's is contained in the pockets there of the honeycomb, right? So obviously it just makes sense. So that's what that has. Now, the essential oil content is about 10%.
So that's
Yeah.
way more than hops, right? It's
Yeah,
very concentrated.
that's right. So there's a lot more essential oils. Again, I'm not too surprised. There's not a lot of water content in
Okay.
propolis. There's not a lot of protein content in propolis. And so you're starting to get more of these resins, waxes, things that are not going to necessarily be water rich, right? And so if there is going to be some kind of extra stuff, if you will, then it's probably going to take the form of oils. Essential oils are going to be there.
Makes sense.
Now, the rest of it, usually they say, well, maybe there's about 5% pollen, maybe 5% simple organics. So maybe something like glucose or something like
Okay.
fructose. And really part of that might be actually bleed through, if you will, from the honey or from the royal jelly. So,
Okay.
that just might be contaminants. Now, and I use contaminants loosely, this is a fat rich and resin rich material,
Okay.
and the flavonoids from within that resins, they probably represent maybe about 6% of the total composition of the bee propolis.
Okay. Okay. So pollen makes up a good amount then of the propolis.
Yes, yes.
And I imagine the source of the pollen then creates many different cultivars, right?
Yeah,
I see all
absolutely.
these different types of honeys.
Yeah, that's right. So which one is best or which one has certain benefits against, certain ailments or whatever. Yeah, that's absolutely right. And that's going to actually play a bit of a role in what we're going to talk about today. So propolis from Brazil, for instance, differs substantially from that found in the bee propolis that's found in Europe or even China, and even in different regions within Japan. So all of that is different. And why? Because it all depends on what else is growing. The bees are going around collecting all of the pollen that they
Right.
can from whatever has flowers, whether it's a cactus flower, whether it's just a regular open sunflower, right? I mean, it doesn't matter. It could be something that fruits or it doesn't fruit, right? And so there's even an interesting, true like fact, like interesting, kind of morbid, but but it is kind of interesting. Even real time, even today, it could be interesting. There's a source of poison honey actually that has been found, and especially it was popular way back. in time. You're talking ancient Greeks and ancient Romans and stuff on the shores of the Black Sea, in now what is, well, modern day Turkey. And it was near the ancient city of Trebizond. And I think the city is now called Trabzon. But it was written about by Xenophon, a Greek historian and military leader who lived during the fourth century. So there's a lot of ons, right? Trebizond, Trabzon, Xenophon. That's why I'm chuckling. But he wrote about the effects of a poison honey on not only animals, but then on soldiers as well who had consumed it.
Okay, wow. Poison honey. This knowledge was over 2,400 years ago,
Yeah,
though.
it was, this has been well established as being a true fact in that area. And so,
Wow.
for those ancients that were in that area, whether they were on a military campaign or just living, they knew what honeys probably to eat or not eat, right?
Okay,
Based
fair
on
enough.
based on what the animals were eating and such, because they could just see what was happening to any, cattle, for instance, goats, whatever
Fair
would end up
enough. Yeah.
eating some of that.
So, what was the source?
Well, so there was a doctor, a research doctor, actually. His name is Dr. Thresh, and he published his findings in the Pharmaceutical Journal and Transactions in the 1887-88 issue. And it was volume 18, page 397 for anybody who's really interested. And the title of the article is called Notes on Trebizond Honey. Anyway, the flowering source that they identified was the rhododendron pontica, also known as the Azalea pontica. And this produces the
Wow.
deadly Andromeda toxin, which is a potent neurotoxin that produces the so-called mad honey disease. The toxin is a diterpene and it causes significant drops in blood pressure if consumed. So you can imagine, especially for anybody who's or anything that is eagerly eating this, drops in blood pressure generally not good, right? You eat too much and your blood, your
All
blood
blood
drop can
pressure
only go so
goes.
much and you're going to pass, right? Now, what's really interesting is that it's not just from the flowering part of the plant in which it's poisonous, it's also the leaves. And so they also have
Okay.
stories about some of the sheeps that were there that in that area that had grazed on leaves of this rhododendron plant and, well, has tragically
Wow.
perished.
Okay. I always learn so much. That's fascinating. Who knew that honey could be naturally dangerous? So, going back to propolis, what's the purpose of propolis anyway?
Yeah, great question. So we know that the royal jelly is made, and that's usually protein rich and vitamin rich, and that feeds the queen as well as the hive's larvae with for the first 3 days of whenever they come into existence.
We recently went to an apiary. It was fascinating.
Yeah, that's right. And but for the queen, she eats it all throughout her life. So if you're a larvae, you get to enjoy it for 3 days, and then you're cut off. Okay,
Okay.
and that's the one that's really rich in the proteins and the vitamins. And we all know that honey, well, I mean, that's what the rest of the hive eats. That's carbohydrate rich.
Yes.
And obviously that's needful because bees have a lot of work to do and they need energy, and carbohydrate is the source of that energy. And so then the other part of this then is the propolis. And the propolis, the purpose of this is really twofold. Number one, structure and protection for the hive. So if there's any kind of gaps or damage that has occurred within the honey like hive system, their home, then they can, well, repair it with
Okay.
the resin like
Yeah.
substances. They can plug holes like if there's a leak from water, that's, they don't call the plumber, they just, produce some propolis
No bee plumbers, I
and
get it.
then I know, right? And then the
Okay.
other reason that they make the propolis is for its antibacterial benefits. So there's always diseases that exist anyway, right? We've already talked
Okay.
about how bacteria produce different, different antibiotics, for instance. I guess in one of our more recent episodes with the citric acid, we were talking about Aspergillus niger, and that produces obviously some of this penicillin too. It can, if it's left to do that, in addition to, citric acid, but it doesn't have to. And well, anyway, the whole point is there's a bunch of different, metabolites, different molecules that are secreted. Even our mouths naturally do this, and they naturally do that to keep the symbiosis of the oral environment. So it's kind of an interesting side note. It's like, well, do you contract Streptococcus mutans if you're all of a sudden going to have decay? Well, you can. That is a communicable disease, technically speaking, but you don't have to. We already have that in our mouth. It's just kept at a modest level in a symbiotic state.
Right.
Just like gingivitis and a lot of these other so-called
I think that's
pathogens
important
on
to
them,
note that they're
right?
already present, but they're
Yes.
not doing the damage.
Yeah, too much. There's like this focus on saying, hey, we need to get rid of the pathogenic bacteria. We've talked about this before in other
Hmm.
episodes. I really don't like that because everything is trying to work together.
Yes.
Too much of a good thing could be a bad thing. Obviously, too much of a bad thing is a bad thing. But, but there are certain species that are definitely regarded more as commensal, like the Streptococcus
Okay.
salivarius and things like that. So anyway, but bees have that too. So in their hives and stuff, or anywhere around there, you're going to have other viruses, other molds, for instance. You're going to have yeast. You're going to have other
It's out in nature,
bacteria.
right?
It's out in nature, especially if an animal that is already wild and doesn't have its flea shots and stuff. And obviously, or Lyme shots or whatever, because they don't. Raccoons,
Right.
bears, think about
No.
that, right? They're going to actually pass along some of those pathogens to the bees if they start sampling the fruit of the
Yes.
bees,
Okay.
whether it's the honeycomb, the honey, the propolis, or the royal jelly.
So the interest is
Yeah.
starting to make more sense.
Yeah.
Okay.
So
So the antibiotic benefits of the propolis are of particular interest for, in this
absolutely.
case, helping to fight bad bacteria in the mouth. That's
Right.
kind of where we are. So is this broad spectrum, do you think? Or are there specific targets that seem to like bacteria it seems to work better
You know
against?
what? It seems to work better against those bacteria which are involved in gingivitis. Okay.
Okay.
Now, there will be some lab data, maybe even some clinical data that shows, hey, this is effective against Streptococcus mutans. Well, that's fine, but that's only part of it.
Okay.
And, I think that that's one of the reasons why some of this hasn't really caught on from a
Makes
commercial
sense.
scale because they can't really get this bee pollen at all, whether or propolis or whatever, to have that kind of long-term effect. So I think that that's why all of a sudden it came out with a lot of interest, especially over 10 years ago, and then it's kind of, diminished a bit. But now there's new data being published, clinical
Okay.
data, and I think it's getting a little bit more, I don't know, I don't want to say focused because probably it was always focused,
Or dialed
but I
in.
think that they're dialing it into, okay,
Okay.
what type of species, how can we extract certain flavonoids to have a benefit? And what should we be looking at here? Maybe not necessarily caries, maybe not necessarily bad breath, but maybe we should be looking at gingivitis and it might even have impact in the perio world as well.
Okay, well that
So
makes sense then. So not necessarily caries or bad breath. So how might the propolis work against the gingivitis causing bacteria such as I believe that's the P. gingivalis, right?
right. Yeah, P. gingivalis, that's it's going to affect our gingival tissue, our gum. So it's nothing to do with the root structure of the tooth,
Okay.
the dentin, or the enamel part of the tooth. So
Maybe bleeding gums or something.
exactly. So
Okay.
that's right. And again, it's really important to remember that this is a reversible condition. Okay. If you see products out there for anti-gingivitis benefits, look at the instructions, read the label, at least here in the US. On the label, it'll say, hey, you can stop after 2 weeks of use. You know,
That was surprising for me to learn.
exactly. So, gingivitis, while it sounds like it's really nasty, that can usually be rectified within a couple days, certainly within a couple weeks, unless there's a bigger problem at play in your
Okay.
mouth that really needs, additional intervention.
Okay, so this isn't unlike then what you've talked about before with white spot lesions on the
Right.
enamel.
Right.
They too can be arrested or reversed. But if the progression ensues with a white spot lesion, that's when the cavity forms.
Yeah, whenever the mineral loss goes through all the way and into the dentin, yeah, now you have a cavity. Okay. And actually it's at that point that S mutans really comes into play. S mutans is usually regarded as the number one enemy. It's not. It's the lactobacillium. There's some other species there.
Right.
S mutans move slowly. That's a slow beast of a
They're
bacteria.
always present, you
And
say.
they're always present, but they need a lot of very nutrient rich
Okay.
feedstock in order to really do its damage, whether that's in terms of producing more acids, more sugar in the form of saccharides to build homes for other bacteria, including like
Mm-hmm.
lactobacilli or other things, and also just to replicate. And so where are they going to get that? Not from the two structure, because that's just calcium and phosphate.
Right.
There are no proteins, or if there, I should say, there's very minimal. Okay, we're talking
Right.
from a relative point of view. If somebody says, "Oh, there's protein," no, there's not much. Okay,
Right.
there's not much carbohydrate, there's not much fat, and there's not much protein. Where all
Okay.
of a sudden the carbohydrates come into play is your dentin because all that is the collagen. Okay. And while there is mineral there, all of a sudden now you're starting to get the collagen, which has protein character, it has some acid type stuff, it has a little bit of some of these sugar characteristics too. But that is really what the S mutans wants. And so that's why S mutans is often found in
Okay.
that underlying structure. So here for the gingivitis and stuff, what happens there is, that could, if left unchecked, could advance to periodontitis. Okay, and that's the crazy stuff where all of a sudden you're losing huge swaths of your gingival line, right? All of a sudden you're having like a depression within your gum line, so it doesn't appear contiguous, right? It's not nice and smooth straight
Like
across. All of a
pronounced
sudden you have
gum
a huge
recession.
dip. It's like a pitfall there. Yeah, and that's going to necessitate obviously, greater
Yikes.
greater intervention, probably a graft of some kind, to
Oof.
help get.
Okay, well, clearly cleaning the gums is important.
Yeah. Oh, oh
So-
yeah,
oh my
absolutely.
gosh.
Yeah, flossing is good, and use some mouthwashes, but really flossing, some people like irrigating, some people like using a rotary brush. That's fine, whatever. But just know with rotary brushes, sometimes the product that you're using may not be ideally suited for the rotary brush, the
True.
electric toothbrush, just because,
We've discovered
yeah,
that.
just because the nature of those vibrations and the rotations may not be in harmony with the purpose and the way that the dental product, the toothpaste or gel, was formulated and designed
That
to
makes
interact.
sense. Yes.
Yeah, that's an underappreciated thing. Usually in the
Yes.
testing of these electric toothbrushes, which are good, they say, hey, it can remove plaque, and it absolutely can. But are they actually good for the hundreds and 200s or even thousands of gels and toothpaste on the market? Maybe not. You
Yeah,
know,
no, that's a very
it
good
might
point.
break down some of these micelle structures. It could
Yeah.
it could actually dilute some of the surfactant properties, and it could reduce then therefore the substantivity
Yes.
related impacts.
Yeah, that was a
Uh,
surprising find by us,
yeah,
I think.
yeah,
Okay.
exactly.
So coming back to gingivalis,
Yep.
the P. gingivalis, of course, is involved with gingivitis, right? It's in the name.
Yeah, it's in the right.
How does this happen?
Yeah, okay. So, again, while acids from like the lactobacilli, for instance, or even the Streptococcus mutans, while those can attack the mineral, the P. gingivalis acts a different way. It's actually generating our own body's inflammation against it by virtue of that P. gingivalis's inherent native structure. Its membrane is coated with the fatty sugar, and these are usually called, lipopolysaccharides, right? These LPS. Now, alone, those are strong irritants to our bodies. So
Okay.
they could be considered an endotoxin. They instigate or they kick off an inflammatory effect with
Okay.
our body. Our cytokines go
Mhm.
crazy. And then in response, that area becomes inflamed. If it becomes inflamed to the point where, it's too much, obviously you're going to have some bleeding, right?
Yes.
And if obviously left more than just the bleeding, then all of a sudden now we start getting into the perio issues, right? Where we start talking about actual loss of gingival tissue or even alveolar bone loss. So it's so funny because the enamel will probably be okay. The dentin might be okay. Even the root might be okay, but not really if it gets into the jawbone because the root of the tooth is also bony. And so that could start to dissolve as well. So
Yeah, well, if a
anyway,
perfectly intact tooth falls out, I think that's a bad thing,
yeah,
right?
but it's just so funny because it's really generated from
Yikes.
our body's response, our immune response to these toxic fatty sugars.
That's pretty crazy. So I wouldn't have thought about it. So I can see where if these are left unchecked, then
Yes.
it can cause major, major issues.
Yep.
I mean, although it's not too common, there have been reports of sepsis and even death from some
Oh,
possible
absolutely.
diseases.
Oh, yeah. I mean, these aren't terribly common, but yeah, there have been,
It
yeah.
can be very
As
serious.
soon as it gets into the bloodstream, it can
Yep.
easily pass through the blood-brain barrier, for
Yep.
instance, and there could be issues there. But again, this isn't affecting, it's not like affecting millions of people around the world, but there are evidence of this that have happened. So it's not
We don't want it to go unchecked.
no, and the other part about this is, and we don't talk about that as much right now, but we could, but others have been, of course, is its relation to just your overall health. Even having gingivitis
Absolutely.
could be an indicator of maybe potentially some cardio related issues, maybe some diabetic related issues. The data out there is kind of up and down.
Yes.
I see that maybe in certain geographies or certain populations, maybe there's more of a pronounced effect than not, but the fact that it could even remotely even potentially have that kind of stuff, it's probably not too surprising. I mean, if your gums are bleeding, you have an issue.
Yeah,
And that
no, it's
issue,
not that surprising.
and it's where it's bleeding because that's our body's response.
Yes,
So if
it
our
makes
body is
sense.
having an inflammatory response there, our body is likely having an inflammatory response somewhere else,
Yeah,
right?
I think the school of thought is definitely more and more towards oral health and systemic health are
Yep.
absolutely tied together. So, what are some of these examples of the prenylflavonoids in propolis?
Okay, so there was a good paper that was published in 2007 by researchers in Japan, and they looked at some of the propolis that was collected from Okinawa, which is the southernmost prefecture in Japan. And they identified these flavonoids. They simply called them, just because of the cumbersomeness nature of the name, propollen A, B, C, D, E, and F.
So, I kind of like that thinking. It simplifies things. We talk about acronyms all the time here.
Yeah,
So, I can definitely follow their ABCs.
yeah, well, me too, especially because if anybody's interested, here's what that propollen A actually is from a chemical speaking term.
Okay, so this is the official
Yeah,
name of
this
it.
is this would be the official name, you know. 5, 7, 3 prime, 4 prime, tetrahydroxy 2 prime, C, 7 double prime, hydroxy, 3 double prime, 7 double prime, dimethyl, 2 double prime, enol flavanone.
Okay, I prefer propylene A.
Yeah.
So let's just go on with that. And you mentioned new clinical data, so
Yeah.
let's move
Yeah,
on.
that's right. So again, and for the record, there appears to be more reviews of Propolis than there are well-designed studies, whether they're lab or clinical. Probably not too common, especially for non-normal or non-conventional, I should say,
Right.
agents. And that also suffers here in this particular case. But it's nice to see that some of these clinical studies are starting to get published
Absolutely.
and new insights are getting shared. So yeah, so here's one study. And before I talk about that, it's kind of interesting because the structure of flavonoids, I've shown you this. What do they kind of look like?
Oh, I'm horrible with the visual, the little
You have a bunch
honeycomb
of,
things, right?
yeah, you have a bunch of hexagonal rings,
Yeah.
right? And most of these are interconnected. And so it almost looks like honeycomb in a way.
It did when you told me
So
the various different.
right. So the flavonoid, so, not that this is truly fractal-like behavior, but for somebody who likes to find even potential,
Right.
synergies between the micro world and the macro world, there is some kind
Yeah, it was
of,
pretty cool.
if you look at the flavonoid structure, and maybe that's good for our listeners or viewers or whatever, you can start thinking of the flavonoids from that kind of perspective. Just tiny, pockets of whatever honeycomb would look
Yeah,
like.
no, that makes
So
sense.
so I think that's good. Okay, so going back to this paper. So in January 2025, there was a paper published in the Journal of Ethnopharmacology, which actually has a cool name, I think.
Yeah.
But it reported on the identification of two particular prenylated flavonoids that were extracted from Brazilian green propolis. So we'll abbreviate that as BGP in moving forward because we're going to
Okay.
be talking about
Yeah.
the extract. So those two prenylated flavonoids are camphoride and betulitol. Okay.
Okay, so slightly easier to pronounce, I guess. So,
Right.
so what's so special about these two forms of prenylflavonoids and this
Yeah, this BGP, right?
BGP?
Well,
Yeah.
the company behind the toothpaste and who funded the clinical study, the name of the company is OHKI Pharmaceuticals Limited, and it's based in Japan. They identified an optimal ratio between these two flavonoids, this BGP, which they also, by the way, have a patent issued in Japan for. I think it was
Okay.
issued in 2022 for the purposes of actually helping to improve the oral microbiota. And, yeah, I mean, that's just, they probably used, I think, minimum, and in fact, I know they did, minimum inhibition concentration data. And in order to, try to first say, okay, what is the likely combination of these and how we then might be able to
Okay.
prepare the right dosing or level then in the toothpaste. So the interesting findings, though, about these two flavonoids is that neither of these alone, like independently, whenever they did these minimum inhibition concentration, we talked about this
The
previously, right?
mix.
The mix, right? They did not have a marked benefit against P. gingivalis. Okay, so alone, they're not as good.
Okay.
However, when they're combined, now you're starting to have a good outcome. What
Some
is the good
synergy.
outcome? Yeah, there's some synergy there. And all of a sudden, they're getting reductions not only in P. gingivalis, but some of the other species that they also screened for, which included Fusonucleatum and Agrigobacter actinomycetum commons. But I know, yeah, I know. So those are generally regarded as more pathogenic species. But fortuitously, they noticed that even whenever these two flavonoids were combined, they did not negatively impact the commensal bacteria, Streptococcus salivarius.
So the good stuff.
Right. And so I think that's good. So they have a ratio of it.
So
Yep.
that's, I know you're a huge fan of ratios. I think nature in general in our bodies, everything is based off of that. So you must have liked this study. What
Yeah,
was,
absolutely
did they
did.
share the secret ratio?
Yeah, they did. It's a 2-to-1 ratio of the camphoride to the butyratol. That worked the best. That worked the best. Again, maximum benefit against the pathogenic, minimum effect on the commensal,
Which is always a
which is
concern.
always a concern, right?
Right,
Yeah, because that's the
absolutely.
concern with any widespread,
You don't want to
you know.
wipe out everything.
Exactly.
Okay,
So,
so you mentioned that was a clinical study.
yep.
So did they use the MIC data to identify then the most promising combination to move forward with the clinical?
Yeah, they did. They based their dosing on that, and they put a level of 0.1% of this BGP extract, this Brazilian green propolis extract, into the toothpaste. They ran two toothpastes, so it was a two-group study. They had 24 people, each taking one of these two toothpastes. The toothpastes were exactly the same, except for one had zero point 0.1 of the BGP extract. Okay, so
Good
yeah,
design.
I like that. The only problem is they only went out in 2 weeks. And so that is the drawback. However, they might be having longer term studies. I don't know. I
Maybe it's
usually,
pilot.
yeah, well, maybe for a pilot, yeah. I mean, normally you would like to see at least 6 weeks. And why? Because even products that aren't even marketed in any way or indicated or, somehow promoted for having maybe potential gingivitis benefits can display good effects within 2 weeks. Okay, this is just one of those things. But can that be sustained? And the reason why it might have an effect after 2 weeks is because, but then kind of die out over time, is that our oral environment, whatever that microbiome is,
Okay.
becomes adjusted to it.
Okay.
And they say, oh, okay, so I see what you're doing and what you're going to be introducing into the mouth multiple times. You know what I mean? And
So
we don't
going
want to
longer
go.
than 2 weeks is definitely a better indication of sustained benefit or
Yeah.
the actual correlation.
Well, that's right. Ideally, you like to see a 3-month study, like a 12-week
Okay.
trial. If possible, 6 weeks. So if any company was gonna do a new drug application and they were gonna come out with hey, we have a new gingivitis thing, you should be doing a 6-month clinical
Okay.
anyway. 3 months would probably be very good. I think we even talked about this. Even the American Dental Association for their seal are going to require two separate
Yes.
complete centers
Yes.
of testing, and it's going to require at least 12 weeks of clinical use.
Right. Well, it's all
For
sounding very
these.
promising though.
Yeah, I mean, I think so. They had okay, so the data was that they had significantly lower plaque index relative to the toothpaste that did not have the 0.1% control.
Okay.
But the gingival index was comparable in both. And, the other benefit was they did have statistically lower bacterial levels from that zero point 0.1, especially with respect to the P. gingivalis, without affecting,
The good stuff.
yeah, the Streptococcus salivarius, which is what they looked at. So from that perspective, it's really good. And whenever they do these gingivitis studies, obviously you have bleeding on probing, you have gingival index, you have plaque index. You
Mhm.
can look at if there's a little bit of perio aspect to it. You can start looking at pulpal or pocket depth. In
Mhm.
fact, not pulpal, but just pocket depths. You can look at retention of the gum tissue, or loss thereof. But anyway, the levels seemed promising, but I think that the lack of any kind of gingival index was just because it just didn't go for very long.
That makes sense.
Plaque,
Okay.
I'm sure it did. But what was interesting too about that, again, if that's the only difference, was just that 0.1% propolis extract. Remember, these toothpaste are toothpaste. They have surfactants in there. They have flavoring
True.
systems in there.
Yes.
And so I think that this was a very encouraging sign.
What's that?
Yep, they just need to go longer, I think.
Okay, so you mentioned there was another study.
Yep, absolutely. So there's another one. Now, this was also done in Japan, but this was at a different university. So the one that I just mentioned was done, I believe, at the Mackay University. That was the location of that clinical set. But here's a different university. It was Okayama University, and they worked with another company called API Company that had their own appy. Maybe it's a play on appy, like the Latin term of the bee is the apis, right?
Right,
And
right.
but that was published also in 2025 in the Clinical Oral Investigations issue.
Okay, so what was their propolis source and what were the study details?
Yeah, this is interesting too, right? They actually use the same Brazilian green propolis. Now, I don't know.
Something
There
special
must be
about it.
something about that, right? So if you want good
Look
stuff,
at it.
get that Brazilian green propolis, right? Yeah. I don't know if it's the exact same source of like who,
Right.
collected it and then distributed it to them, but it was considered the same, BGP. Okay.
Very interesting.
But they didn't do any sophisticated extractions to try to identify those optimum flavonoids. They didn't use any of that kind of background research.
They
And
weren't
then,
dialing it down.
no, they just took the green propolis and they extracted it in ethanol to then ultimately get a 2.5% propolis ethanol extract that they then put into a toothpaste.
Okay.
And so, what I like about this study as well, same exact toothpastes, one just had the 2.5% extract.
Let's see.
So,
That's good stuff.
yeah. Now, I also like this study because it went out 4 weeks. So
Oh,
we're starting to get longer assessments, right? And they actually looked at patients that didn't just have gingivitis like the other one did. These ones were actually had undergone periodontal therapy and sometimes they regard this as like people that are participating in supportive periodontal therapy. So
okay. Help me
yeah,
out with that one.
I mean, what that
That
means
sounds a
is
little different.
they had periodontitis, they got it corrected.
Okay.
If there were huge pocket depths, right,
Yeah.
those would have been recreated, right, using grafts, probably from the palatal region, maybe elsewhere, but they had to have at least, three depths of having at least 4 to 6 millimeters in range. They had to be at least 20 years old and they had to have at least 20 teeth as the participants. But these people were already going to be, as part of this therapy, you have periodontitis. This is a real issue. It's an uncomfortable issue. And so you're going to be willing to probably have a more focused regimen and be able to
Absolutely.
try new things, different things. And so I think that that's always helpful. So if you have a willing participant group, obviously there's always the risk of what's considered maybe the Hawthorne effect or any kind of placebo effect,
Right.
where what you're going to be using is going to be helpful, but that's okay because you don't know which one you're getting. That
Right.
effect, which could be in sensitivity studies, that effect is like 40%. It could be as high as 40%. Yeah,
Wow.
it's pretty significant. So that's why it's always good to have a good control
Yes.
within a given clinical, regimen that is being administered there. That's something we haven't
Wow.
really talked too much about, but maybe we'll talk about it in other episodes. Who knows? But yeah, these had the two toothpaste.
Well, that's fabulous. I like that they used identical toothpaste and they
Yep.
didn't use different brands or formulas.
Yep.
So what did they find?
Yeah. Well, clinically, okay. So together, there weren't any statistical differences between the two groups.
Okay.
Okay, but both groups like statistically reduced the level of, well, in this particular case, the baseline and total bacteria counts, not only the total but also P. gingivalis, but also the bleeding as well. There was trending though that showed that the toothpaste with the propolis extract seemed to have even greater reductions in P. gingivalis as well as total bacteria, as well as bleeding on probing. So
Okay.
the BOP. Did they really get much of anything else? Not really, but they did identify that there was improvements in the pH of the saliva actually
Oh,
when they tested it. So the one with the propolis actually had a better, less acidic, pH environment
which
in
could
saliva
mean
after use of
less
the
damaging
4 weeks.
bacteria.
Yeah, that's right. So I think that's probably the take home point there. So they had a lot of people in here. They had, I believe it was over um, 24 people at least again in each group. They went over 4 weeks. The bleeding was reduced, the bacteria counts reduced. I would still consider this then to be a pilot study. You know, you kind of want to push that out a little bit further,
Hmm.
and we really need to see. But also, the people that had the B propolis toothpaste actually had shallower pocket depths as well
Okay.
from a perio perspective. So I think that was good. Again, both toothpaste help reduce pocket depth, but the trending definitely showed that the propolis was more beneficial in reducing those pocket
Okay,
tips
well,
as well.
it definitely sounds promising
Yep,
and believable.
unbelievable.
And sounds like, to your point, if they would have gone longer, it might have shown that statistical difference.
Yeah,
It's
yeah,
possible.
yeah. We just don't know. I would really think so. I would really think so. At least after 6 weeks, and then maybe even out to 12 weeks. So, I think that that's really interesting. And the only drawback is
Oh,
what is the effect of the ethanol, right?
oh,
What is the effect of the ethanol versus the propolis? I mean, one might have a better benefit, but
one.
is it due to one of those ingredients? Is it really due to the synergy? Or is it due to the synergy of that ethanolic extract in combination with the other ingredients that we just
Okay,
talked about? They used a quote unquote soap base to describe their surfactant system. I think it was sodium lauryl sulfate, but that wasn't necessarily
right,
disclosed. They also had some peppermint oil, which can also have some beneficial, impact in the
right.
oral environment. And they also used a known preservative, which we don't typically use. It kind of smells like a little bit like roses. And so it's not, you have to be careful in formulating oral care products because
Yeah,
not too many people want to put on,
rose smell in
yeah,
their mouth.
or then maybe you have to mask that somehow.
Right.
Yeah, but it's called phenoxyethanol. Okay, so that's the ingredient, and it's usually used as a preservative. And so that was also present in the system. So, was it due to a synergy of having the ethanol, the phenoxyethanol, the peppermint oil, the soap base, and the propolis? Or what exactly was there? So,
It sounds like,
it would have been great if they would have had also in the toothpaste, just put in 2.5% ethanol, but no
right,
propolis.
right.
You know what I mean? And then you truly start to dial that in
That
and
makes sense.
start to
Yes.
figure it out. But from a pilot perspective,
And overall, it's showing that there is a trend there for the antimicrobial then.
yeah, I think so. And at least they're trying to do a clinical study. I mean, my goodness, with how many products?
Control at least.
Yeah, they had a control. I mean, I think it was better than not having or having some other random, but I think that they could even dial that control in better. If not, that's okay. You don't have to, but then don't claim that B propolis is doing all of this great
And
work,
that's
right?
what you've said many,
Yeah.
many times for. So are there other clinical studies that don't involve the Brazilian green problem?
Yeah, there is. I saw one, and this one is a little bit questionable. I
Okay.
know it was published in a good journal. If there's any academics out there, anybody that likes to publish in BMC
Well,
Oral Health, which is
go
regarded as a
on.
good journal, it's regarded as a good journal. And I'm not trying to throw too much shade, but let's look at we always have to look at, well, what are the potential drawbacks of the study,
Yeah. A
right?
setup.
And here's why we have to do that, because lawyers do that. And why do they do that? Because if you're advertising products, especially in the US, it'll ultimately come to that if your product is
It's a
successful.
great point.
The panel's going to look at that. They're going to say, okay, if I'm a consumer, can I be reasonably assured that I can trust all of this information, these marketing claims that are being thrown at me?
Absolutely.
So it ultimately will get there.
Hmm.
So that's the reason why we care. We can save a lot of heartache, or you can undergo and then change things later. Who knows? But
Yeah, anytime
yeah.
attorneys are involved is not good, right?
Yeah. So, yeah, this paper was published in 2024, and it was by some Pakistani researchers. Here's the first problem that I have with this paper
Okay.
is that they had their college pharmacy create a 20% propolis mouthwash, but there are no details on what that mouthwash was. Like, we don't know the flavoring of it. I don't know how much alcohol total it had. We don't know if there was any other ingredients in there. I mean, it could be, like, let's just like Guru Nanda, right? The brand that has various oral care products. They put in like tons of different essential oils. I mean, it could be you have 10 or 20. I mean, there's tons of things. And some of those essential oils are known to have good benefits
Yes, you've
in
said.
reducing malodor or even gingival health, right? It can
Right.
improve it. So I don't know what was in that mouthwash. And even a 20%, you know, because we've been talking about these hops and these,
Yes.
and obviously now the propolis, these are derived from resins. And are resins water soluble? No. So you might be using ethanol for your extraction. And
Right.
so if they are using a 20% propolis mouthwash, assuming that there's going to be 20% ethanol.
Okay.
So I don't know. So, but the whole point is, at least they used they're trying to be investigative, but I don't know if we can attribute all that only to the power of the propolis.
Right, because some
So
of it
let's
could be attributed to the ethanol.
exactly. So
Okay,
we
that makes sense.
or other ingredients that just happen to be in the
Like
mouthwash
this.
and discuss. So we can't just say, "Hey, bee propolis is
Okay,
great,"
yep. Nope,
right?
that's
So,
fair.
but they did not use Brazilian bee propolis that I'm aware of,
Okay, so
not in reading the paper.
what were the study details?
Yeah, so this is kind of interesting. So they didn't use Japanese researchers, but what I do like is that they used 144 people divided into two groups, and the other group, the other mouthwash group, was chlorhexidine. Okay. And so it wasn't necessarily a true placebo, right? It's not like you have a mouthwash with 20% and then a mouthwash with, everything exactly the same and you don't have that. So
Right.
again, this is where
There's where some of those nuances
yeah,
come
these are
in.
the nuances. I do like the fact that they went out and they did it 6 weeks of use. So that's better than 2 weeks and 4 weeks. And
Right.
then there was a post 6 week follow on assessment to see
Okay.
how their gingiva was. I like that. So the whole study ultimately went out to be 12 weeks. So we're starting to get to that time
Okay.
period where maybe we can start paying attention to say, hey, look, maybe there is something here. But again, are your controls absolutely correct?
Right.
And do we truly know what is doing the work?
Okay.
And do we have the right controls? So, in terms of, what we can expect over that
Right.
6 week period anyway, because certain active ingredients respond differently. As an example, because somebody's might thinking, really, how might that be? Like triclosan was one of the more popular ones. It took a long time. The induction period for that to actually have gingivitis benefits took at least sometimes 6 weeks to start getting that turnover and that
Which is
expectation
really
of the microbes to
crazy.
be able to have that effect. Yeah, I mean, would you notice immediate benefits? Of course, but really the better benefits would go on and not be as noticeable, right? Until longer use
Okay.
relative to, say, for instance, a Listerine mouthwash or
Right.
something,
That makes
just
sense.
just something different. So that had been in there in some of the data. Obviously, triclosan is not in toothpaste now, but there are nuances here. So that's why I even bring that up. So their patient pool, I think, was pretty restrictive. I mean, they restricted this to
Okay.
perimenopausal women,
Okay.
which, it's going to be hard for everybody to identify with that. Like for me, I don't know if I'd be able to identify with that
No.
study outcome because obviously I don't fit that category, right?
I'm
So not only are
not
you
even gonna go
female,
there.
but perimenopausal, and so it's a little bit too concentrated,
Yeah, I
right?
agree.
So it's not necessarily reflective of society at large.
Fair enough.
So that's one. But in the end, great outcomes. There were significantly greater reductions in pocket depth, clinical attachment loss, CAL, which I had mentioned before,
Yeah.
that could become a problem, and bleeding on probing, also known as BOP, including at the 12-week mark. So even 6 weeks after cessation of use
That
of
follow-up
the
was very useful
mouthwashes.
then.
Yeah, and it was mostly in favorable of the 20% propolis extract.
Okay, so that's all promising. I agree the sample population may not be representative on the average, of course, but I do think that 20% is quite high, and I'm wondering what was the
Yeah, I know. It,
composition?
it it always comes back. We want to be able to take away from that. You look at such good results and you want to know more, not because we're necessarily questioning, but we just want to know more. Like, that's awesome. Well, what do
Yeah.
you think? Well, what was the reason for
Was it
that?
attributed to,
We
right?
live in the information age where now we want to know what is in
Yes,
the products, and
absolutely.
we can find this quite easily too. But if they keep it on the down low, now, just for an example, if somebody says, well, 20%, is that normal? Listerine uses 21.6% alcohol in their mouthwashes whenever they combine that with
I remember
deodorizing.
you saying that. Yeah.
Yeah, they do have alcohol-free mouthwash, but 21.6 is one of their more familiar,
Okay.
formulations that has ethanol in it. But there are other mouthwash formulations that also have alcohol, but it's at a lower content. They don't necessarily use essential oils. They use cetyl pyridinium chloride. The brand is called Cepacol. It has been one of the original mouthwash brands. Maybe not too many people use it, but that has about 14% of
Okay.
alcohol in that
Good
formulation.
to know.
Yeah, and that's with cetylpyridinium chloride.
Right.
So you have ethanol having one benefit, you have
Right.
APC having a benefit, and there's some addition there. And the reason why somebody even would use ethanol anyway, somebody might say, well, why would they even use ethanol? Is that kind of cheating? Not really, because ethanol is the great solubilizer. It is awesome at creating emulsions.
Okay.
Whenever you take oils that typically cannot be, right, mixed
Yeah.
very well in water and it And by adding in the alcohol helps to emulsify that, and you create one single phase within water because ethanol plays nice with water and it plays nice with oils.
So it's like
So
it marries them up.
yeah, so again,
Then
sometimes whenever you see formulations with alcohol, and
that's the
it could
purpose.
very well be, even in this instance, that is why, So even if it's only two and a half
Wow.
percent B propolis in the ethanol, it's because alcohol is the great emulsifier. It's not because they're looking to get something that's going to help do the hard work, the dirty work,
Right.
and kill some stuff. Obviously, it can, but it's used because oftentimes some of these companies or the formulators or whatever, they don't know what a good alternative to ethanol might be.
Makes sense.
So
Makes sense. And I would think that it's cost effective as well.
it is cost effective, and and through the process of the ethanol, you can also help try to drive certain structures and molecules. So if you want like a nice straight chain of your active ingredient to be active, like acetylpyridinium chloride, use ethanol.
Okay.
If you don't use ethanol, use something else, there's a chance that that straight chain could all of a sudden turn into some kind of
Okay.
spherical cluster, could like a vesicle or something, or just something that may not be, just may not be
Right.
as effective as the long chain. So,
Okay.
so those are some of the reasons why that might be the case.
I love that. Well, in the end, I think we learned a lot about propolis, including the fact
Hmm.
that important clinical testing is now being shared. I mean, it sounds like there might be, I'm hoping in the next year we might see some more studies that come
Yeah,
out
it'd
with
be
more
really nice.
data.
Yeah, especially if they can really
Okay.
pinpoint it on to how, if is it gingivitis?
Right.
Is this what we can do? And we need to know, well, how long does it last? I
I
mean,
love it.
I think that'd be the best because these problems, they come and go, and sometimes they're just chronic. It all
Yes.
depends on the situation, and sometimes it's unknown why all of a sudden you'll get
Yes.
a pocket depth that all of a sudden just is created. It's not because you're chewing tobacco. It's not because you're necessarily brushing hard, right? All of a sudden it could just develop, and it's, what did I do?
Yeah.
So
So you never know. So
although that is rare, I mean, I'm
it
not
is,
gonna
but
say
it's our bodies are always it's fluid. It's always ever changing. So I think this is a great follow on to our previous episode with P&G
yep.
and citrus and hops for oral care. And it would seem that prenylated flavonoids, whether it's hops or propolis,
Yeah.
are indeed promising.
Yeah, just remember, if you find yourself somewhere, sometime around and in the area of the Black Sea coast near Turkey, just be careful of
Don't
the
have any
honey
honey.
that you might eat. Just be careful.
Oh my goodness.
Take just a smidge of it, just a little
Just give it
dab.
to your friend and see what happens.
Just say no. Either way, right? I mean, that's it.
Yes.
So, all right. Well,
Okay.
thank you for listening, everybody. Alongside Tami, my co-host, again, I'm Dr. Rob, and you're listening to the Dental Formulators Playbook. And remember, stay curious and keep smiling.